Hi, everyone. This is a fabulous way to start a lecture. We're going to talk about wound healing in this segment, and it's short, and we're going to talk about the two different types of wound healing you might see. So, this, if you had to guess, is it deep wound healing or superficial wound healing or epidermal wound healing? Well, it is certainly deep wound healing. You can see the layers here. This particular cut went through the epidermis, the dermis, the subcutaneous layer. Let me actually kind of point these things out, and into the muscle. So you have epidermis way up here. This here is dermis. And then like over here you can kind of see the subcutaneous layer with its blood vessels, and then you can see some fascia, which is connective tissue, and then down, of course, into the muscle. So this is actually a friend of mine who got bitten by a cookie cutter shark as he was attempting to swim from the Big Island to Maui. So he had to stop that trip, but he went back about a year later and did the whole thing. So anyway, he is amazing, and he's also over 60, so inspiration. But anyway, there it is, wound healing. Got granulation tissue? I sure hope so. Okay, so epidermal wound healing is really simple. So this would be something really minor that does not go into the dermis. So this is the dermis here. Epidermal wound healing has to happen only in the epidermis. Would it bleed? Well, does epidermis have a blood supply? No. So epidermal wounds do not bleed. So it's like a really mild abrasion. Like again, if you scrape your finger along the surface of your epidermis and it leaves a white line, that's epidermal wound healing. Or a really minor burn, like first-degree burn. So what happens is if it goes all the way down to the basement membrane, and you scrape away some of those cells here, then what happens is the basal cells will migrate. They'll move from where they're dividing up here, and they'll slowly push their way this way. And you can see this one's dividing, pushing this way until they touch each other. Once they touch each other, they undergo contact inhibition, which means once they touch each other, they stop moving. And then you have a growth factor, which is a chemical that stimulates the basal cells to divide. So here they are right here, dividing like mad, because they want to replace the ones that migrated. So eventually, full thickness of the epidermis is achieved, and this gets filled in, and there is no scar because there's no fundamental change to the structure of the epidermis. What about deep wound healing? This is when the injury extends to deep to the epidermis, to the dermis and to the subcutaneous and onward. So typically there's some sort of scar formation from deep wound healing, even if you can't see it. So we have 4 phases that we'll look at. And here they are, inflammatory through the maturation phase. So in deep wound healing, the first thing that has to happen, like let's say you basically cut your skin and it bleeds. The first thing that will happen is you'll have a blood clot. And then what that blood clot does is it stops the flow of blood outside of the body, right? You don't want to keep leaking blood everywhere. So the blood clot will stop it. And that's where, as we mentioned, the blood cell, the blood basically can make fibers that create a blood clot. Okay, so that's one thing that happens in this first phase. So the first phase is called inflammatory. So inflammation is actually a useful thing in the short term. We think of it as bad, but in the short term, inflammation really helps us with wound healing and helps protect us from invaders. So the blood clot unites the wound, and then you have epithelial cells migrating, across the wound. And you have the main thing about inflammatory is that the blood cells dilate, which means they get bigger and it's more easy for blood cells to escape, so that white blood cells, which are for immunity, can get out into the tissue, because when you make a cut, it's very easy for a bacteria, we'll call this B for bacteria, to get into your body and invade your tissues. So when you open up your blood vessels, things like phagocytes and other immune cells can kill the bacteria so that you don't get an infection. All right, so the other thing that happens is fibroblasts form, and those fibroblasts in the migratory phase are going to lay down fibers. And when there's a lot of fiber, we end up with some scar tissue. So you can see this is the very end stage, the maturation phase. We see, well, there were fibroblasts here, and now there's some scar tissue, because fibroblasts lay down fibers, and a lot of fibers means you've made a scar. So anyway, you have blood vessels beginning to grow, new ones that were disrupted beginning to grow. And during this phase, the tissue filling in the wound, all this stuff here is called granulation tissue. And that's good. That's to actively growing, healing tissue. So when we ask back here, got granulation tissue, we should say, yes, we sure hope so. That is granulation tissue filling that wound. Okay, proliferative stage is just the migratory phase intensifies. And then maturation, so you've got more movement of epithelium, you've got more blood vessels repairing and making new blood vessels. Maturation is here, this picture right here. And that is when the scab, you've all had a scab fall off, that would be the maturation phase. So the epidermis has been restored to its full thickness. Collagen fibers get more organized. Fibroblasts are disappearing because they're not needed. You don't need fibers anymore. And blood vessels are returned back to normal. So here you've got a nice solid blood vessel. But notice here, you don't have a blood vessel going through that scar tissue. And that's because, talk about this next one, scar tissue can result from deep wound formation. So what happens is collagen fibers are very dense in scar tissue. So there are fewer blood vessels, and that's why your scars often look lighter than the rest of your skin, because it's basically mainly collagen fibers, and blood vessels weren't part of that scar right here. So typically, scars aren't as functional. They don't have hair, they don't have sweat glands, they don't have sensory structures, so a big scar can actually inhibit the functionality of your skin. Okay, so stop and think. Which takes longer to heal? Well, of course, deep wound healing takes longer. So make sure you stopped and thought about this on your own. Which phase of deep wound healing does granulation tissue fill the wound? In the migratory phase. Find a scar in your body. What is it? Why is it there? Well, it's not why is it there. It's there because you had a deep wound, but why is it the way it is? It is the way it is. It's light colored, it's less functional, it's harder because it has a lot more collagen fiber in it than regular dermal tissue. What is the drawback of having a scar? It may not be as functional. It may not be able to sweat or have hair or have blood vessels pass through it. That's it. If you have any questions, please ask, and please do take some time to look through the other PowerPoints that are not narrated. It's very straightforward, and you may find reviewing that helpful for the exam.